Anyways, my name is Randy Jackson. I teach in the School of Social Work and in Health and Aging at McMaster, and I'm also a PhD candidate, just about ready to finish up, hopefully. And and I'm Anishinaabe from Kettle and Stony Point First Nation, and I think that's it for me.
And I'm Saara Greene, and I also teach in the School of Social Work at McMaster University. Oh, and I'm Saara Greene, and I also teach at the School of Social Work at McMaster University alongside Randy, and I'm a part of the Stable Home Strong Families team.
Yeah, I'm part of that team too. Anyways, we're going to talk a bit about our preliminary findings from this project. So just by way of acknowledgement, our research team, which has grown over the last 3 years, and as people were getting interested and wanted to be involved, we added people. We have our research staff that we'd like to acknowledge, and our peer research associates who were really instrumental on the ground in local communities, helping us to organize the digital storytelling workshops and such. We'd like to give a special thank you to Rob Kershaw at the Story Center, which was formerly the Center for Digital Storytelling in Berkeley, California. He actually gave us a training around how to do digital storytelling and how we could sort of organize our workshops. And then, of course, our funding was provided by the Canadian Institutes of Health Research. Just by way of background, Aboriginal people are, and I think we all know this, are disproportionately affected by HIV. Although we represent about 4% of the Canadian population, we're about 9.1% of all prevalent HIV infections in Canada, so that's quite a disparity. Aboriginal youth and women are disproportionately represented, and IDU is a prime route of infection. Housing, we became interested in housing because it's an important determinant of health, right? So Aboriginal people tend to be overrepresented and linked to housing instability. There are higher rates of homelessness among Aboriginal people. Aboriginal people often live in crowded and unsafe dwellings. The urban Aboriginal population is in need of housing. And unstable housing and homelessness and HIV are connected in ways that are associated with poorer physical health, poorer mental health challenges, and HIV-related risk behaviors. Rates of HIV infection tend to mirror housing as a structural inequity, and the lack of affordable and appropriate housing has been powerfully implicated at risk for HIV exposure and with care and health of persons living with HIV. So based on we knew all this sort of going into the study, right? And so we decided we designed this project, right, to identify and work towards addressing the gaps in appropriate housing options that support cultural identity and concepts of home for Aboriginal peoples living with HIV and AIDS, right? And the focus of our presentation today is going to be exploring the various links to and understandings of home and housing from the perspective of our participants. And our participants were men and women, different cultural orientations from across the country. I think that's it, eh? Yeah. Okay. So our research design was a community-based participatory research design drawing on decolonizing and indigenous methodologies, and we also use principles of two-eyed seeing, which is essentially this idea that you draw on the strengths of Western ways of knowing the world, and you attempt to balance that with indigenous ways of knowing the world, right? We had an arts-based qualitative data collection, which was the digital stories. And digital stories are understood as these sort of 3 to 5 minute visual narratives that synthesize images, video, audio recordings of voice and music and text to create these compelling accounts of experience. At the beginning and we held 4 workshops across the country, 4 or 5. Anyways, in Victoria, Regina, we had 2 workshops in Toronto and one in Fredericton. And at the start of these workshops, we had we had sharing circles where people sort of started to unpack some of how they understood housing and home, right? And that spilled into this conversation about what kind of stories they wanted to tell using their digital storytelling platform. So prior to this, of course, three of our team members, myself, Saara, and Marnie, attended a 4-day digital storytelling training session at the Story Center in Berkeley. And then we came back to Toronto after that, maybe about 3 months later, and we took our peer research associates through that same workshop. So it gave us an opportunity to develop our skills around how to help people prepare a digital story. And so our PRAs also created their own digital stories around housing and home. So the purpose of the training that we did, we decided to do this and create our own digital stories because we wanted to have some experiential knowledge around what it was we were asking our research participants to do, right? So we wanted to experience perhaps, and we did, I think, some of the same kinds of vulnerability that come with disclosing parts of who you are in public settings, right? And we also wanted to do the digital storytelling, as I said, the training to gain some sort of technical experience around how to help people create their own digital stories. So we, as I said, we had four sites: Victoria, Toronto, Regina, and Fredericton. Our recruitment was assisted by our peer research associates and as well as our community partners in the local settings. Workshop sites in each of the regions was determined by the peer research associate, and they also engaged with local elders and helped us to design ceremony around collecting data that was appropriate to the cultural context with which we were collecting the data. So again, we had this sacred circle that was opened by an elder, and participants were offered a traditional gift before being asked to share their stories. The exercises were conducted to engage participants in unpacking the 7 elements of digital stories. And those 7 elements are understood as your point of view of the story, this dramatic question that you want to answer as in the context of your digital story, how to bring in emotional content to engage audiences, how to use your own voice in a digital story, how to add soundtrack, and how to pace it and how to lay it out in ways that take you along on that story. So we worked with each of the participants in each of the workshop sites to write a script around their stories, right? So these scripts were written, they were edited and tightened as we moved through the early part of the workshop, and we edited it in a way, and we suggested things around including how people culturally understood housing experience. So once these scripts were finalized, what we did was we audio recorded them, and we worked with members of the research team to build their digital stories and using Final Cut Pro. And sacred stories, once that was all done, sacred circles were reconvened towards the end of the 4-day workshop, where we got sort of the backstory around some of what the participants wanted to convey in their digital story, their experience around producing that story, as well as the content of the story themselves. They filled in much more detail in the sacred circles at the end of the 4-day workshop. And I think I'm going to hand it off to you.
So we are going to be showing you some digital stories, but we came together actually after all the workshops were completed, and a team of people, those of who could come and who would want to participate in the analysis, actually came together over a 4-day retreat that we did about 3 or 4 hours from Toronto. And we had people from the team who were service providers, frontline service providers, elders, researchers, and peer research associates. So we got like a really nice cross-section of the team engaged in the analysis process. And we drew on, but didn't use exclusively, a participatory analysis process. We shifted that process in ways that worked for our team by going away on a 3.5-day retreat in northern-ish Ontario. So as I said, we were all team members, and we worked together, and we were supported by Tetehente, who was an elder from Six Nations, who grounded us in Indigenous ceremony, knowledge, and experience throughout the process of analysis. And our analysis process was also guided by Indigenous teachings by team members, including a principal investigator, co-investigators, 2 peer research associates, and by our elder. And in this way, we were grounded in Mohawk, Cree, Silks, Anishinaabe, and Haudenosaunee knowledge. I think, what was really quite important for all of us was that even before we started the analysis process, we came together, we shared a meal, and the morning before, we sat by a fire and really were grounded in the teachings of our elder before we even sat down with the materials. So when we actually came together, we were assigned groups and we worked in partners, and we worked with transcripts, and we had done coding before we actually came together. We made like a coding tree of a range of different themes, and we used those themes to help us sort of decide what quotes made the most sense to go under which theme. And the most meaningful quotes, I wouldn't say meaningful, but I would say sometimes quotes that people shared were just a bit brought in more than one idea together, and it sort of helped us to sort of get a broader understanding of the whole range of issues. So sometimes, one person in their story would share something that brought together a range of themes that would articulate a particular issue or concern that I'll get to in a moment. And then we actually took those themes later on and mapped them onto a medicine wheel. And I'll talk a little bit more about our development of the medicine wheel in a moment. But because there were people from various cultures and different ways of knowing and experiencing Indigenous culture, we actually shaped that circle to be more representative of the range of knowledges and experiences in the group. The stories and the quotes were really difficult to map onto the medicine wheel because, as you can imagine, lots of discussion. Many of us had sat side by side, participants, and sometimes had a different perspective on a particular quote because we were sitting there with someone, right? And we heard the story. So we had lots of discussion, lots of different perspectives on trying to understand what somebody was saying. That took both the person themselves telling us what they said, but also a reflection on the conversations that we had with participants as we did that work. So if you can see the photo here, we took quite a long time to develop this picture, and it really, we wanted to use the medicine wheel figure as a symbol to really express the notion of all my relations. And we took in Cree understandings and Anishinaabe understandings of the medicine wheel to, like I said, develop where we were going to be putting the quotes that different people shared with us and the stories that different people shared with us. And so then those key quotes were selected and they were mapped onto the wheel. So the thing about the digital stories, and I think we're going to show them to you before we actually get into the analysis itself. Mm-hmm. Yeah. We wanted to say that while the digital stories are part of our analysis and our findings, we also see them as stories that just stand on their own. It's someone's experience. They're telling a story, and regardless of our analysis and interpretation, we want to honor those as a story that was shared in and of itself and not just as simply part of a larger research study. Using listening and the listening of those stories are really a jumping off point for discussion, even before we did the analysis, and can be a jump off point for discussion here today. And it really helps us to move towards a deeper understanding of using a decolonizing lens to understand experience and how to address experiences in terms of the policy and practice context that we hope to change and shift. And so we have 2 digital stories that we want to share with you. Mm-hmm. I should probably just say one more thing about the analysis that's quite important, because we when we actually did sharing circles both at the beginning of our workshops every day and at the end of the day. And we recorded those sharing circles as well. So when we were doing our actual analysis, we weren't just analyzing the transcripts of the digital stories. We're actually also analyzing the transcripts of the sharing circles where people could actually reflect on their digital stories and having seen each other's digital stories, also engage in a conversation. What you can imagine people resonated with each other's stories in different ways. So those were recorded as well, and they are part of our analysis. And the other piece that we haven't got to, but that we are also analyzing or looking at, is the images that people have chosen to use in digital stories. Rocks, water, birds, trees, all those sorts of things, and also the music as well. Because we actually, when we were asking people to make digital stories, we were getting them to think, what kind of music do you want to have? And if you do, where do you want to place it? So, for example, in some of the digital stories, people chose to use traditional drumming and singing, or recorded music of songs that were meaningful to them, or the sound of running water, that sort of thing. So like I said, this is just our preliminary findings that incorporates the transcripts from the digital stories and from the sharing circles, but we have yet to sort of integrate the images and the music into our analysis piece. I'll share this, okay? So again, this is preliminary findings with a group of us that have worked together over 3.5 days. And our first one was the theme of embodying home. So people talked about, home as being a place where a person resides into connection to themselves, others, and the world around them. There were stories about family, community, world, nation, the larger universe. It's feeling safe. It's where we live in ceremony, where I come from, and where we experience reconnection. Folks talked about quality of life, peaceful. Words like serene became really important key ways to describe what a safe and stable home was. And that it's, of course, not just housing. Home means something much deeper than that, and it's about something that grounds an individual and a community, about being a place where someone can heal and move forward in their lives in the ways that they are choosing to move through it. And that even though some folks talked about living in low-income housing, this could actually be a palace compared to other ways in which they'd lived prior to that, but also because they were very much involved in decorating what the house and the home that they lived in looked like. They decided what was going to be in that space, and that's what felt like home for them.
Okay. So our next theme that emerged from the analysis was this idea of home as a journey, right? So journeying in the sense of living the good life. And this was described as experiential, something that's experienced, it's sacred, and this acceptance of life on life's terms, right? So in the context of challenges that people face, this is particularly poignant, I think. It's people described how I'm still growing and I'm still learning as being connected to this idea of home as a journey. It's where you learn to talk from your heart. So it's learning how to be authentic. What I gained through the teachings is a sense of self-acceptance. It gives me the strength and perseverance and healing. I draw on all of my teachings to create home versus I must learn to reconnect, reclaim teachings, and to create a better home. So there was this incredible sense that people were on this journey through life, that home helped them ground that process.
Okay, so another preliminary finding, another theme was managing health. So with lots of stories around living with HIV and managing one's health, conversations about addiction, medications, and housing. So as one person said, I was diagnosed HIV before I turned 24. This devastated me, brought me to a crossroads. I could go back to the street life and succumb to a darkness, or make good memories and take the time to heal what I broke. And so that, again, that decision to walk a different path was really connected to healing and being able to actually be in a space where that healing could happen in a safe and supported way. Another person shared, when I was diagnosed with HIV, I couldn't tell you how much I wanted to live, how much I wanted to at least make things right for my kids, who I abandoned because of my addiction, because I didn't know how to deal with everything. I didn't know how to look at everything with straight eyes. So anyway, being that young and everything, it really made me think about this home, my body, my home here. So we heard more than one time people talking about their body being their home. And oftentimes some of these stories were even about body being the home of their unborn child, or remembering being in their parents' womb, or like talking about, their mom's body being home. So that was really, really interesting and very much connected to responsibilizing things that we take care of in our lives, that being one's body. And as one woman said, it took the HIV to kind of slow me down and dummy me up. I'm not damaging or hurting other people now. And again, it was really much about thinking about how do I take care of myself, manage my health, and recognizing that in order for that to happen, this connection to home and a safe space was an absolute necessity.
So our next theme was this self to universe, right? So this is a really key finding for this project, right? So it's this relational quality that people have between themselves and the larger universe, right? And that was in the context of housing, right? Home to me is where I am surrounded by ceremony. It's where I feel safe, loved, wanted, and free to be me, right? And another person shared, coming from a culturally adept family, I came to know my people's traditional events. It's always become a family affair, right? So this idea that healing and health is not just an individual pursuit, right? And we probably heard this too in Tuchol's, the earlier presentation, is very much connected to community and community health, right? So and people live their lives in that way as this intimate, deep sense of connection with not only family but with community and one's nation even, and that sense of connection, that relational quality that people embody as they move through life, as they journey through life, is central to health and wellness.
And then more broadly, we saw stories around meaning of home specifically. As I said earlier, over and over again, hearing that home is more than housing and it goes beyond the material. Home is not a possession, it's something that resides within. Nature is home, feeling connected is home, and the road was my home for a long time because I was comfortable there. So it's even a space where people just feel that they belong, even if that might be different to what we think home is. And home is within, I am a sacred place. So we often, again, when people, participants, either reconnected or connected back to themselves, they really felt that their bodies were this sacred place, and this is home. So ways that people maintained a sense of home was really connected to reclaiming culture, reflection, teachings, and through these processes, participants really could talk about how they reconnected with family, with nature, with traditions, and with themselves. So the meaning of home becomes this really broad understanding and concept. It's not, the four walls. It's really connecting culture, family, traditions, teachings, and a feeling about oneself. Those are all a very important key thing for us to think about when we're thinking about developing housing, for people living with HIV from Aboriginal communities. And of course also have direct policy implications, right? The way that I think home and housing and addressing issues of housing instability and homelessness have been addressed are actually do not reflect the needs and experiences of the folks that participated in this project. So it's about really rethinking what home is as we're thinking further to developing housing policies and practices.
In addition to the key themes we identified in our analysis, is the importance and centrality of culture, right? So emerging from all of the DS, or the digital stories, were this idea of the importance of spirituality, teachings, traditional teachings, family and elders, right? And how cultural knowledge and experience are intertwined throughout the stories and throughout one's life, actually. And this highlights that any move towards developing housing practices and policies that are aimed at supporting Aboriginal people and those affected by HIV must be grounded in Indigenous culture, as Saara was just briefly talking about.
We learned a lot through this process, and we'll go through those, and these are in no particular order, but for us, conducting, and I think we already knew this to a certain extent, but I think this project really reaffirmed for us that conducting research with diverse Aboriginal communities across Canada really requires working in partnership with peer research associates, with local elders and community members who bring those diverse identities and experiences to the table even before you start sort of developing the process itself, right? That really has to happen first. So those developments, those partnership developments really were integral as they were developed long before we actually started the whole DS digital storytelling workshops pieces. This is a really very critical component of our community engagement process because of the colonization of Aboriginal peoples, and the residential school system really has created a mistrust of outsiders within the community. So we spent a very long time trying to develop those relationships because, we were working across the country. And even though we had peer research associates from across the country, many of us reside in Toronto or, in certain places. So it wasn't just about relying on people that lived in Saskatchewan or BC or different places. We couldn't rely solely on them. We had to develop those relationships amongst our team members first, and then make sure that we use those relationships to develop relationships within those different regions so that we could actually really work as a team. And so we really carefully planned for respectful engagement at the local level, at the provincial level, and at the national level to build this familiarity, this intimacy and trust. And we couldn't have done it actually without the support of the peer researchers. And in fact, initially at the beginning of our study, we hadn't put funding aside to do digital storytelling training with our peer research associates. And they said, how can you expect us to be a real partner in this process if we don't get to experience this ourselves? And so we said, you're absolutely right. And so we just rejigged the budget and we made that happen. And to this day, it's really because of their ability to say this is what we need if we're going to be an equitable partner in this project, and actually continued to say that all the way through. And we could see, how integral that was to understanding experience and to building those relationships within those communities.
So one of the things we encountered, and Saara touched on this a bit, right? But our peer research associates needed to be trained and supported in all aspects of the research. And it started with as Saara was saying, the digital stories and wanting to learn what that process was around putting together digital stories. But there was also training involved around how to do analysis, how to manage the data that was coming in, those kinds of things. But capacity building is never sort of a one-way street, and I think we learned an enormous amount from our peer research associates. And for me personally, one of the things I learned was how to incorporate, and this was taught to me from our peer research associates, how to incorporate ceremony as part of the research process. I think I got a really good lesson on how to do that as part of this project. Again, elders were approached from each of the locations to help ground the participants and team members, but also to bring this cultural and spiritual aspect to data collection and the workshop experience. And these sessions were quite powerful. On the West Coast, we had at the end of the 4 days, we had a blanketing ceremony and brushing off ceremonies as part of moving forward, and it was like such a powerful. I wish you could have all been there. It was such a powerful experience to have gone through that. And our elders who were involved at each of the sites, and there were different elders in each site, brought a different aspect of the ceremony particular to that cultural context. Ceremony and cultural teachings were integrated throughout our data collection phase, and as we saw earlier too, it was incorporated into our analysis phase. And early engagement with elders, community supports, and organizations was actually very crucial to that process, because as Sarah was telling us earlier, that there's this challenge of mistrust in the research process, and this needing of building relationships in order to move forward in a good way. Agendas intentionally included ceremony and elder support throughout our time together. Team members, peer research associates, and research participants were invited to be part of all the ceremonies that were a part of this project, and everyone was included in our prayers for the success of the research and the well-being of everybody everywhere. And I think we got a very good lesson in that when we were doing the analysis in northern Ontario, northern-ish Ontario, with our elder who we had an opening ceremony where he described to us the connections between self, community, nations, and universe, and all around a fire. It was really quite a beautiful experience. And we brought that forward and embedded that as we moved through the analysis as well. So I think that's all we have.